This is All India Radio. We now bring you a special program on COVID-19. Good morning. I am Lalema Aneja Dang, and with me is Subhadra Ramachandran. The headlines. Government extends nationwide lockdown till May 17. Relaxations in green zones to push economic activities while restrictions continue in red zones. COVID-19 recovery rate improves above 25% in the country. Special trains start ferrying stranded migrant workers and students. Production of protective gears and medical equipment to fight COVID-19 ramped up considerably. Government hikes minimum support price for 49 minor forest produce. And US Food and Drug Regulator allows emergency use of remdesivir for treatment of severely ill coronavirus patients. The centre extends the ongoing nationwide lockdown by 2 weeks from the 4th of this month. The Ministry of Home Affairs issued an order to this effect under the Disaster Management Act 2005 to extend the lockdown further. The Home Ministry said the decision has been taken after a comprehensive review of the COVID-19 situation. Here's a report.
The prohibited activities include travel by air, rail, metro and interstate movement by road, running up schools, colleges and other educational institutions, hospitality services, cinema halls, malls, gymnasiums, sports complexes. All social, political, cultural and other kind of gatherings and religious places or places of worship for public will also remain shut. Movement of persons by air, rail and road is allowed for select purposes as permitted by Ministry of Home Affairs. Outside the containment zone falling within red zones, certain activities are prohibited in addition to those prohibited throughout the country, which includes plying of cycle rickshaws and auto rickshaws, running up taxis and cab aggregators, intra-district and inter-district plying of buses, and barber shops, spas and saloons. Industrial establishment in urban areas including special economic zones, export-oriented units, industrial estates and industrial townships with access control have been permitted. Construction activities in urban areas have been limited to in-situ construction where workers are available on site and no workers are required to be brought in from outside. E-commerce activities in red zones are permitted only in respect of essential goods. Private offices can operate up to 33% strength as per requirement with the remaining persons working from home. All government offices shall function with senior officers of the level of Deputy Secretary and above at full strength and the remaining staff attending up to 33% as per requirement. Most of the commercial and private establishments have been allowed in the red zones, which includes print and electronic media, IT and IT-enabled services, data and call centers, cold storage and warehousing services, private security and facility management services, and services provided by self-employed persons except for barbers. In the green zones, all activities are permitted except the limited number of activities which are prohibited throughout the country irrespective of the zone. However, buses can operate with up to 50% seating capacity. Anupam Mishra, AR News, Delhi.
The number of COVID-19 cases in the country has climbed to 35,365, while the death toll rose to 1,152. Health Ministry data said the number of active COVID-19 cases stood at 25,148. As many as 9,064 people have been cured or discharged. Briefing media in New Delhi, a Health Ministry official said recovery rate has improved to above 25% in 14 days, which is a positive sign. Just over 25,000 people are under medical supervision. He said state and district administration should ensure focused efforts that red and orange zone districts break the chain of transmission through effective and stringent containment measures.
जैसे कि आप सभी को पता है कि देश के विभिन्न जिलों को रेड, ऑरेंज और ग्रीन जोन में बांटा गया है। राज्य और जिला प्रशासन द्वारा कंसंट्रेटेड एफर्ट्स करते हुए यह इंश्योर करना है कि जिन भी जिलों में केस आए हैं, यानी कि रेड या ऑरेंज डिस्ट्रिक्ट, वहां पर इफेक्टिव और स्ट्रिंजेंट कंटेन मेजर्स के थ्रू चेन ऑफ ट्रांसमिशन को ब्रेक किया जाए। केसेज एंड कॉन्टैक्ट, यानी कि जितने भी केसेज आए हैं उनको और उनके कॉन्टैक्ट को मैप किया जाए। वह केसेज और उनके कॉन्टैक्ट, उनका ज्योग्राफिकल डिस्पर्शन क्या है, उसको एनालाइज किया जाए।
Home Ministry officials said that the ministry has allowed movement of stranded persons such as students, migrant workers, tourists and pilgrims through rail as well.
आज गृह मंत्रालय ने आदेश जारी कर उन लोगों की आवाजाही की अनुमति रेल द्वारा भी दी है जो लॉकडाउन की वजह से फंसे हुए हैं, जैसे स्टूडेंट्स, माइग्रेंट लेबर, टूरिस्ट और पिलग्रिम्स। इसके लिए संबंधित राज्य सरकारें एवं रेलवे बोर्ड उचित व्यवस्था करेंगे और सभी हेल्थ प्रोटोकॉल्स का अनुपालन सुनिश्चित करेंगे।
She said Ministry of Home Affairs has reiterated to all states and union territories that as per the consolidated revised guidelines on lockdown measures, no separate passes are required for thorough traffic of trucks and goods carriers, including empty trucks.
आर्थिक गतिविधियों को और आवश्यक वस्तुओं की समयबद्ध आपूर्ति के लिए ये जरूरी है कि गुड्स ट्रैफिक को इंटरस्टेट बॉर्डर्स पर रोका नहीं जाए। दिशा निर्देशों के बावजूद देश के कुछ हिस्सों में ट्रक्स और गुड कैरियर्स की मूवमेंट में समस्या आ रही है। गृह मंत्रालय ने फिर से स्पष्ट किया है कि ट्रक्स और गुड्स कैरियर्स की मूवमेंट के लिए चाहे वे भरे हुए ट्रक्स हों या खाली हों, अलग से पास की आवश्यकता नहीं है। राज्य सरकारों को अनुरोध किया गया है कि वे सुनिश्चित करें कि जिला प्रशासन एवं फील्ड एजेंसीज इन निर्देशों का पालन करें।
Special trains have started ferrying stranded migrant workers, students and others in different parts of the country. Railways has announced that it will run Shramik special trains to bring back home people stranded in different parts of the country due to lockdown. The passengers have to be screened by the sending states and only those found asymptomatic would be allowed to travel. Sending state governments will have to bring these persons in batches that can be accommodated in the train to the designated railway station in sanitized buses. It will be mandatory for every passenger to wear face cover. 2 trains carrying stranded workers and students of Bihar from Jaipur and Kota will reach Patna this afternoon. These trains started journey at 10 p.m. last night. About 1,200 passengers are in each train. There are 24 coaches in these trains, including 18 sleeper coaches and 4 second-class general coaches. The special train is being run at the state's request. Sanitization of Patna railway station is being carried out under supervision of railway officials before the arrival of trains. Bihar Chief Minister Nitish Kumar has thanked the Union Government, Indian Railways and Rajasthan Government in extending support to bring back migrant workers and students.
In Rajasthan, hundreds of migrant workers and students left for Patna and Ranchi through 2 special trains last night. Our correspondent has the details.
Around 1,200 migrant workers of Bihar have been departed to Patna by special rail service from Jaipur last night. Migrant workers identified by the state government were allowed to travel in this rail service. Another special train carrying 942 students from Jharkhand left for Raj from Kota last night. Kota district collector told AIR that about 27,000 students studying in different coaching centers have been sent to various states so far. He told that another special train will depart with students from Kota to Dhanbad this evening. Around 1,000 students are also leaving for Delhi today by buses. Chief Minister Ashok Gehlot had instructed to ensure all arrangements for smooth and speedy movement of migrants and workers. Jitendra Dwivedi, AIR News, Jaipur.
The first Shramik special train carrying more than 300 migrant workers from Nashik in Maharashtra will reach Bhopal this morning. Second special train is running between Nashik and Lucknow. Here's a report.
Both these trains will also pass through Bhopal station, but there will be no stoppage in Bhopal. The train coming from Nashik to Bhopal departed Nashik at 9:30 last night. The train contains 8 coaches. Chief Public Relations Officer, West Central Railway, Jabalpur Zone, Priyanka Dikshit informed that it will be mandatory for all the labourers to wear masks. Food will be provided by the railways to the labourers in special trains running for longer distances. Health checkup will be conducted by the concerned state governments at the time of boarding and landing of labourers. The special train coming from Nashik to Bhopal has labourers from several districts of the state besides Bhopal. These labourers will be sent to their respective districts from the buses by the state government. Officials informed that labourers will have to follow all the guidelines of lockdown, including physical distancing in the station premises. Keeping in view the security of the special trains, the railway has deployed RPF and GRP personnel at Bhopal station. Sanjeev Sharma, AIR News, Bhopal.
The first special Shramik train carrying migrant and stranded labourers reached Hatia railway station in Ranchi late last night from Telangana. Around 1,200 migrant and stranded labourers of the native state were welcomed with rose flowers, face masks, packaged food and water upon reaching. Thermal screening and registration of all the workers who deboarded the train was carried out at Hatia railway station itself. As many as 60 Sanitas buses were kept ready at the railway station in Ranchi to take these workers to their respective villages. More from our correspondent.
Post-lockdown, the state government had been preparing the database of close to 1 million migrant labourers of Jharkhand who were stuck in different parts of the country. With the collective efforts of the central and state government, Jharkhand has been able to bring back its stranded labourers from Telangana. Labourers, while deboarding the train, were seen with shining faces upon reaching to their native place. Every single person was medically screened and, by maintaining social distancing, taken to their respective buses for onward journey to their villages. All measures were taken care of by government officials to maintain physical distancing, sanitization and medical checkup. While few of the labourers would be asked to undergo home quarantine if required, some migrant workers could be sent to institutional quarantine. In two special-off trains which also started from Kota yesterday for Dhanbad and Ranchi respectively, close to 2,900 students studying in different coaching institutes will also reach to their destination by tonight. This is Shilpi for All India Radio News from Ranchi.
Assam government is taking steps to bring back stranded people outside the state following the guideline issued by the MHA. Official sources said that at least 5 lakh people are stranded outside the state. The government has appointed a nodal officer to look into the matter. Chief Minister Sarbananda Sonowal has held a review meeting in Guwahati this evening on the issue. Mr. Sonowal instructed the concerned authorities to make necessary arrangement to bring back stranded people phase-wise.
Karnataka Chief Minister B.S. Yediyurappa has assured migrant workers of resuming economic activities in the state. The assurance has come in the tweet by the Chief Minister to wish the workers on May Day yesterday. He appealed to all the migrant workers to stay back in the state. The state government has set up a task force under an additional Commissioner of Industrial Relations to take appropriate decisions on the grievances filed by the workers on wages and retrenchments. Representatives from trade unions and industry bodies are its members. Deputy Chief Minister Govind Karjol announced yesterday that the Social Welfare Department will buy fruits and vegetables directly from farmers for its 8,000 residential schools and hostels in the state. Here's more from our correspondent.
In an important decision, the Social Welfare Department has put an end to buying vegetables and fruits from middlemen. The Horticultural Producers Cooperative Marketing and Processing Society, HOPCOMS, will fix prices of vegetables and fruits for farmers to sell their produce directly to the hostels run by Social Welfare Department. The minister has said that hostels belonging to scheduled castes and tribes will be encouraged to buy vegetables directly from farmers. The officials for the department have been asked to draft guidelines for this purpose. The government will provide a subsidy of 50,000 to 1 lakh rupees for those setting up fruit and vegetable shops. Sudhindra, AIR News, Bengaluru.
Production of personal protective gears and medical equipment to fight COVID-19 has been ramped up considerably in the country. Government has said that it has ordered 2.22 crore personal protective equipment PPE, of which around 1.42 crores will be bought from domestic manufacturers. Addressing media persons, chairman of one of the 11 empowered groups said that against the projected demand of around 2.01 crore PPEs, order has been placed for more than 2.22 crore such equipment. He said earlier there were no domestic manufacturers of PPE and almost all of them were imported, but now we have 111 indigenous manufacturers. He said the PPE production capacity has increased so much that it has become a 7,000 crore industry in India, the biggest after China. According to the government, the current domestic production of PPEs per day is around 1.87 lakh. He said about 19,398 ventilators are available in India and orders have been placed for 60,884 more. Of these, 59,884 will be produced indigenously.
Government has raised the minimum support price for minor forest produce of 49 items in view of circumstances arising out of COVID-19. Tribal Affairs Ministry said the increase across various items of minor forest produce MFP ranges from 16% to 66%. The increase is expected to provide an immediate and much needed momentum to procurement of minor tribal produce in at least 20 states. The ministry said that the MSP for minor forest producers is revised once in every 3 years by the pricing cell constituted under the ministry. It said that in view of the exceptional and very difficult circumstances prevailing due to COVID-19 pandemic, the competent authority has decided to relax the existing provisions in the scheme guidelines and revise the MSP. Prime Minister Narendra Modi held a comprehensive meeting to review the strategies that could help in making India's civil aviation sector more efficient. It was decided that the Indian airspace should be effectively used in such a manner that the flying time is reduced, benefiting the travelling public and also helping the airlines to save costs in close cooperation with the Department of Military Affairs. For generation of more revenue as well as to bring in more efficiency at the airports, the Ministry of Civil Aviation has been asked to expedite the process of handing over of 6 more airports on PPP basis by commencing the tender process within 3 months.
Consumer Affairs Minister Ramvilas Paswan has approved the integration of 5 more states and union territories with the national cluster under the One Nation, One Ration Card plan. These states and union territories are Uttar Pradesh, Bihar, Punjab, Himachal Pradesh and Dadra and Nagar Haveli and Daman and Diu. 12 states have already under One Nation, One Ration Card plan, namely Andhra Pradesh, Goa, Gujarat, Haryana, Jharkhand, Kerala, Karnataka, Madhya Pradesh, Maharashtra, Rajasthan, Telangana and Tripura. 200 new mandis from 7 states have joined the eNAM platform for marketing of agricultural produce. They include 94 mandis of Rajasthan, 27 mandis of Tamil Nadu, 25 mandis each from Uttar Pradesh and Gujarat, 16 mandis of Odisha, 11 mandis of Andhra Pradesh and 2 mandis of Karnataka. This will bring the total number of eNAM mandis in the country to 785.
In our series Experts Speak on All India Radio, we bring you the views of the leading medical experts on COVID-19. Dr. Anant Mohan, Head of Pulmonary Medicine, AIIMS, has advised people not to take medicine like hydroxychloroquine or anti-malarial without a prescription by a doctor.
Please do not take medicines such as azithromycin, other antibiotics, antivirals or hydroxychloroquine or other anti-malarials without a proper prescription by a doctor. Do not self-medicate.
Ms. Jacinta Gunjial, Senior Nursing Officer, AIIMS, has stressed on the need for social distancing.
Social distancing is a non-pharmaceutical infection prevention and control intervention to break the chain of infection.
Senior physician at RML Hospital in Delhi, Dr. Desh Deepak, has said that the lockdown has resulted in checking the rate of growth of corona patients in India.
जब से लॉकडाउन हुआ तो इसकी जो दोगुनी होने की जो रफ्तार वो कम हुई है। जैसा हम जानते हैं कि शुरू में लगभग 4 दिन के आसपास थी और अब वो 11 दिन के आसपास है। तो ये एक तरह का टूल है जिससे कि हम उसको देखते हैं कि अच्छा ये कितना गंभीर है, जिसको हम लोग फ्लैटनिंग द कर्व कहते हैं कि अब हम जान रहे हैं कि हमारे देश में काफी लोगों में संक्रमण हो रहा है। अगर यही संक्रमण इकट्ठा एक साथ हो जाएगा तो उन लोगों को जो केयर चाहिए वो नहीं मिल पाएगी। लेकिन अगर धीरे धीरे होता है तो हॉस्पिटल्स की मोर देन सफिशिएंट कैपेसिटी है अभी जिस रेट पे हो रहा है उसको आराम से डील करनी।
This is All India Radio bringing you a special news program on COVID-19. Let's take a look at the headlines once again. Government extends nationwide lockdown till May 17. Relaxations in green zones to push economic activities while restrictions continue in red zones. COVID-19 recovery rate improves about 25% in the country. Special trains start ferrying stranded migrant workers and students. Production of protective gears and medical equipment to fight COVID-19 ramped up considerably. Government hikes minimum support price for 49 minor forest produce. U.S. Food and Drug Regulator allows emergency use of remdesivir for treatment of severely ill coronavirus patients. For quick news updates round the clock, follow us on our Twitter handle @AIR News Alerts. Krishna
दर्शकों का पसंदीदा धारावाहिक श्री कृष्ण जल्द आ रहा है डीडी नेशनल, फ्री डिश और अन्य डीटीएच चैनल पर। सब्सक्राइबर्स अपना चैनल नंबर नोट करें। फ्री डिश 001, टाटा स्काई 114, एयरटेल 148, सन डायरेक्ट 302, वीडियोकॉन D2H 149, डिश टीवी 193 और डेन 138। आगामी आकर्षण धारावाहिक श्री कृष्ण।
Chief of Defence Staff General Bipin Rawat has said that armed forces will undertake several activities to show solidarity of the frontline soldiers with the corona warriors tomorrow. Briefing media in New Delhi, General Rawat said the armed forces will organize multiple events like flypast by fighter and transport aircrafts of the Indian Air Force from Srinagar to Thiruvananthapuram and from Dibrugarh to Kutch. The helicopters from the Air Force and Navy will be showering flower petals on the hospitals treating COVID patients. The Navy and the Coast Guard will move ships in formations at sea at select locations, while Army bands will visit COVID hospitals and play tunes outside the hospitals in an expression of gratitude to the corona warriors. While talking of the contribution of the police personnel, the Chief of Defence Staff thanked them, stating that they have put an exceptional and heroic effort. General Rawat thanked all corona warriors, doctors, nurses, other health workers, hygiene and sanitation staff, police personnel, media personnel and all Indians for a remarkable effort in this unprecedented fight. The Chief of Defence Staff said the corona warriors have ensured that India keeps on fighting the pandemic. He, along with other three services chiefs, saluted them and their efforts and wished them the best of health. Maharashtra saw a big jump in the number of coronavirus cases yesterday, with 1,008 persons testing positive, the highest in a day so far, taking the tally of cases to 11,506. The State Health Department said 26 COVID-19 patients died yesterday, taking the death toll to 485. Municipal Corporation of Mumbai said out of the total number of reported new cases, Mumbai alone contributed 751 cases. Similarly, out of 26 deaths reported, 5 were from Mumbai. 106 patients, including 95 from Mumbai, were discharged yesterday. Health Minister Rajesh Tope said that 83% of coronavirus patients in the state are asymptomatic. He said 20% of them have recovered. In a release, the minister said that the mortality rate of the epidemic has come down to 3.5% in the state, while the doubling rate of patients is more than the national average.
In Gujarat, the number of COVID-19 cases has gone up to 4,721, with 326 new cases reported yesterday. According to sources, 3,713 patients are stable, while 36 patients are on ventilators. 236 people died so far, while 736 patients have been cured and discharged from the various hospitals. More from our correspondent.
Out of 326 new cases reported yesterday, 267 cases recorded in Ahmedabad only, 26 new cases recorded in Surat, while 19 cases recorded in Vadodara. Out of total 4,721 cases in the state, 3,293 cases are in Ahmedabad. State government and municipal corporation have taken series of steps to control the COVID-19 spread in the hotspot areas. Principal Health Secretary Dr. Jayanti Ravi gives more details.
Entire health team is working there with full coordination, and we have also ensured that the distribution of Ayush medicines, especially homeopathy prophylactic doses of arsenicum album, has been taken up in a very big way in Khambat Nagarpalika and is giving very good results.
Meanwhile, Chief Minister Vijay Rupani held interactions with the heads of 167 Nagarpalikas and Sarpanch of 467 tribal villages of Panchmahal district through video conferencing on the occasion of Gujarat Foundation Day. Sarpanch of tribal villages took the pledge for My Village, Corona Free Village. Yogesh Pandya, Air News, Ahmedabad.
Chhattisgarh Police is conducting corona rapid test of all its officials deployed in active duty. Talking to AIR News, Director General of Police DM Avasthi said the directions have been given to all district police force to conduct such tests for the safety of police officials and their family members.
हमारे अधिकारी हैं वो लगातार निरंतर उसमें ड्यूटी कर रहे हैं और वे लोगों के संपर्क में भी आते हैं। अनजाने में भी लोगों के संक्रमण के संपर्क में आ सकते हैं। ऐसा नहीं हो कि इन्हें कहीं इन्फेक्ट हो जाए और फिर उनके साथ साथ दूसरे लोग भी इन्फेक्ट हो जाए। कोरोना के टेस्ट सबसे पहले जो 50 साल की उम्र के हैं उनको कराया जाए और जो लोग एक्टिव ड्यूटी में उनको कराया जाए। जो बाकी जनरल ड्यूटी कर रहे हैं उनको ना कराएं। सभी जिलों में करने के आदेश दिए गए हैं। सब मिला के कई हजार लोगों का टेस्ट होगा धीरे धीरे।
While an assistant sub-inspector of Raigad district of Chhattisgarh tested positive in corona rapid test. Now the report of RT-PCR test is awaited.
In Himachal Pradesh, about 16 taxi drivers from Una district are setting a unique example in the fight against COVID-19. In order to deal with COVID-19 pandemic effectively, these handful of people have dedicated themselves and their vehicles in public service through district administration. Here's a report.
About 16 taxi drivers of the Prepaid Taxi Union of Una City have come forward to deliver services in fight against COVID-19 pandemic in their own way. Ram Kumar Sharma of Basal village in Una district has a taxi attached to the union. When he came to know that district administration has a shortage of vehicles to carry the stranded people and to deploy the corona frontline warriors, Ram Kumar and his colleague met the Deputy Commissioner and the Superintendent of Police to offer taxi services. Although the district administration has assured to pay fuel charges to these taxi drivers, but they are determined to provide these services even if the administration does not compensate it. Besides this, Ram Kumar Sharma also dropped positive COVID-19 patients to hospitals without any hesitation, which is really noteworthy.
मुझे अच्छा लगा कि चलो हम किसी की मदद कर रहे हैं सर। पहले भी मैंने 10-12 हजार लोगों को जोड़ रखा है टैक्सी ड्राइवरों को कि किसी को भी जरूरत पड़ती है। कोई ऐसा नहीं है, कोई गाड़ी वाला हो, चाहे कोई बाइक वाला हो, चाहे कोई भी हो, हर इंसान की मदद होनी चाहिए। तो बस मेरे को यही था कि जो कोरोना के पॉजिटिव लोग आए हैं वो अच्छे होकर अपने घर में पहुंचे सर।
In this time of crisis, the taxi drivers of Una district undoubtedly the source of inspiration for others. With Rajesh Sharma report from Una district, this is Sanjeev Sundaryal, AIR News, Shimla.
Union Territory Ladakh School Education Department is taking help of apps to save the education year of the students. Advisor to Ladakh, LG Umang Narula, has launched DSEL online education mobile app in Leh on Friday. Here's more from our correspondent.
Unlike other parts of the country, Ladakh schools start new academic year in November and reopen in March after 3 months winter break. However, to save the academic year of the students due to uncertainty in reopening of schools due to lockdown, the UT administration is using all options to reach out to the students through various modes. Leh and Kargil Hill Councils have already started classes for the students with the help of all India radio stations in the region. To provide visual classes to the students, Kargil District Institute of Education and Training has developed a DSEL online education app for class 1 to class 9. The app is available for download in Google Play Store. While launching the app, Mr. Umang Narula advised the Education Department to make the content available for the students who are not in mobile network areas. Divisional Commissioner Sagat Biswas said the Education Department is making efforts to provide the audio-visual content offline as well. Ramesh Chandra for All India Radio News, Leh.
In United States, the Food and Drug Regulatory Body, FDA, has allowed emergency use of the antiviral drug remdesivir for treatment of severely ill COVID-19 patients. A study by Gilead Sciences in US has shown that remdesivir shortens the recovery time by 31% or about 4 days on average for hospitalized COVID-19 patients. President Donald Trump announced the FDA's action at the White House.
And now an overview of today's newspapers covering COVID-19 stories. Graded easing of curbs over 2 weeks is the Hindustan Times headline. Another report on front page says all major cities are now part of 130 red zones. Arogya Setu app must for all employees who resume work is a Times of India headline. Beekeeper's sweet gesture, honey for COVID warriors is a tribute headline. Despite losers, Progressive Beekeepers Association in Jalandhar have offered to offer honey to doctors, health workers and journalists as mark of gratitude to their spirit. Doordarshan's rerun of Ramayana has created new world record for the most watched entertainment show in the world with 7.7 crore viewers, reports the Hindustan Times.
And now the headlines once again. Government extends nationwide lockdown till May 17. Relaxation in green zones to push economic activities while restrictions continue in red zones. COVID-19 recovery rate improves above 25% in the country. Special trains start ferrying stranded migrant workers and students. Production of protective gears and medical equipment to fight COVID-19 ramped up considerably. Government hikes minimum support price for 49 minor forest produce, and US Food and Drug Regulator allows emergency use of remdesivir for treatment of severely ill coronavirus patients. And with that, we end the special news program on COVID-19.